What we're going to look at now is CPR. So what we're going to do is look at what CPR is and how to actually do it. Now the first thing is look at what is CPR. CPR stands for Cardiopulmonary Resuscitation. So what this is we're going to run through a process of giving chest compressions and breaths to keep this person with oxygen-rich blood going around their system. So the idea is by pushing down on the chest, we're going to squeeze the heart. And when you squeeze the heart, there's blood in the heart, so it's going to force any of that blood out because there's only one-way valves going in and out the heart. So when you squeeze it, it has to be going out through the arteries. So by pushing down, we force the blood out, and by letting go, we suck more blood back in. So it's crude, but it does perform an element of circulation. So although the heart is not beating on its own, it is still pumping blood out as we push down on the chest. The idea of breaths is we're going to apply breaths into the lungs to flush out the air so we can put oxygen into the lungs more than that's in there now. So there are other types of CPR we're covering different videos, and that is chest compression only. This is where we just give compressions. So the first thing we need to do is to approach the scene safely, as we've covered this in other films already. So we're making sure there's no dangers. We're going to introduce ourselves, and we're going to give them a tap on the collarbone to make sure that they're actually, whether they're okay, to try and get an answer back from them. Because at this stage, we don't actually know this person requires CPR. Now the requirement for when do we start CPR is, are they breathing? Yes or no? Now with breaths, we are looking for normal breathing. Now it could be that they have agonal breathing. This is a gaspy, raspy type noise. Now it does happen in anything up to 40% of chances. So this is not normal breathing, it's just a gaspy type noise. So we mustn't mistake that for normal breathing. But by doing a breathing check, we're checking the breathing, but also looking down the chest to see the chest rise and fall. As far as starting CPR, what we're trying to do with this is the second link in the chain of survival. So the first link will be activate emergency services once we found out they're not breathing. And the second link is early CPR. Now the sooner we get started on this, the better. Now watching this film, you might think, oh, I'm not going to remember all this, it's very difficult. It's not difficult, it is very straightforward. And what you'll be doing is you're learning this information now, and you'll be able to recall this in an emergency. It's going to be stressful, it's going to be tough, but you will make a difference, because with the person who's not breathing, their chance of survival is dropping and dropping and dropping. And what we need to do is make sure the defibrillator, an AED, arrives as soon as possible. Now the defibrillator is there to shock the heart, and hopefully it will restart beating in a normal fashion. Now the chance of survival drops by around about 10% every single minute that you have to delay the AED arriving. So the point of CPR is trying to extend this period, keeping the body oxygenated blood flowing through it, keeping the brain and the vital organs alive, so that hopefully when the shock is delivered, then we can bring this person round. Now we're going to carry this on until the defibrillator arrives. We're also, when the paramedics arrive, they will come in and they will take over. But don't just stop just because they walk in the room. They will probably need you to carry on doing chest compressions until they get all their equipment ready. So ask them, they will talk to you anyway, but find out what they need to do. So you carry on doing your CPR, gives them a chance to get the defibrillator ready, because the key thing here is shocking them as quickly as possible. So anything you can do to make that shock come on quicker, then that's ideal. So now what we're going to do is look at the process for CPR. So the first thing we did is to assess the scene, stop, think, act, approach the patient, and just introduce yourself. Hello, my name's Keith, I'm a first aider, may I help you? And we're trying to get a response, and then give them a tap on the collarbone. Are you okay? Are you okay? Asking a direct question to, again, hopefully get a response. Next thing we need to do is open the airway, because with the head in a rested position, it's likely that the tongue has fallen to the back of the throat, and this can stop them breathing. So by opening the airway, it pulls the tongue away from the back of the throat, and then hopefully they'll start breathing again. To do this, we use the head tilt chin lift method. Hand on the forehead, the other hand underneath the chin, we tilt the head right the way back. That way is open the airway, it's pulled the tongue away from the back of the throat, and then we need to pop our ear down and have a listen. So we just have a quick look, see if there's anything in the airway, just in case there was something obviously obstructing the airway, and we need to put our ear right down close, and we're keeping our ear very close, keeping the airway open the whole time. We're looking down the body, and we're trying to assess whether they're breathing. So you do this breathing check for 10 seconds. So while you're doing that, count out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After the 10 seconds, the next thing we need to do is activate the emergency services. So for this, we would take our mobile phone out, or if we have to phone nearby, if you're on your own, we must call the EMS, because if we don't, then we're going to carry on doing CPR and there's no one going to be here to come and help you. So when you make that call, tell them nice, clear information. Now the ideal would be if you've got a mobile phone, put it onto speakerphone, you can leave the phone by the head, and then you can start CPR even while you're calling the emergency services. That can save a valuable time, maybe a minute in the time you would be talking on the phone. You can be doing continual chest compressions, and also the operator on the other end will be able to help you and guide you through the process right up until when the emergency services arrive. If you're sending someone for getting the EMS, then give them good, clear instructions and keep it short and easy. Just say something like, can you go and dial 999, ask for an ambulance, tell them we've got a non-breathing adult and we are doing CPR, tell them the address where you're at, and then, most importantly, and come back and tell me what they say. Because we need to know that emergency service has been called, that they haven't got distracted and not actually made that call, because we might need to leave and make the call ourselves or send somebody else. The other thing you can do is ask if there's an AED available. Where we are right now, there is an AED at the workplace, so we could send someone to get that AED unit, and then that will speed things up before the EMS even arrive. Once we've activated the emergency services, the next thing we need to do is do the compressions. So what we're going to do is we're going to place our hands, interlock them. We're going to push down on the center of the breastbone with the heel of the hand. So interlock your fingers, push right the way down on the center. We also need to put our shoulders above, so we're pushing down straight onto the breastbone rather than pushing down at an angle, because it's the most effective way of pushing down on the breastbone and hopefully pushing down on the heart to expel the blood out of the heart. We're going to do a depth of 5 to 6 centimeters, and we're going to do that at a rate of between 100 and 120 compressions per minute. Now that's roughly 2 compressions per second. The other really important thing to do is we push down, but we must also fully release. So don't push down and then leave any pressure on. We must make sure that the heart fills back up with blood when we release. If not, this process will be less effective. So we arms right above, arms straight, shoulders above, and we're pushing down 30 times. And again, you can count out loud so that everyone around you knows what you're doing, and hopefully there'll be less chance of distracting you. If you do get distracted and you lose count, yes, we're saying 30 compressions, but if you do 28 or 32, it's not a problem. So if you're not sure, then just get the compressions done, but try and count out loud. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. The next thing we need to do is open the airway, the same as we did before. So we're tilting the head right the way back. If you've got a barrier, put the barrier on, whether it be a pocket mask or a sheet barrier, whichever. You need to squeeze the nose, otherwise when you blow into the mouth, what can happen is the air can come straight out the nose. We need to squeeze the nose. We're then sealing our mouth around the mouth of the mannequin, and we're blowing in 2 breaths. And we're blowing those breaths for about a second until we see the chest rise. We don't want to be putting loads and loads of air in, because eventually that air will just go expand the lungs, and then it can just pass down to the stomach and it'll be less effective breaths. So we'd literally squeeze on, open the airway. Once we've done the 2 breaths, we want to try and do this quickly. So from compression 30 breaths back to compression 1, ideally you want to try and keep that at less than 5 seconds. So it keeps it nice and steady. So breath in, out, in, straight back onto the compressions. And then we go straight up to the top, and then we carry on with the compressions. And we do 30 compressions, 2 breaths, 32, 32. And we continue that as long as we can until the emergency services arrive. And if you get tired, you can hand over to a second rescuer. We'll cover how to do that in a separate video. And also, if you get tired, you might find it easier just to do chest compressions rather than doing the breaths. But ideally, you want to be doing 30 compressions, 2 breaths, 32, 32, until the AED arrives.